Hello, everybody. I think we can start. I prefer to start on time as we have a very beautiful topic today, and I would like to have enough time for discussion. So welcome to the EuroBloodNet Topic on Focus series of webinars for patient organizations. My name is Natasha Bolaños. I represent the Lymphoma Coalition. Lymphoma Coalition is a global network of 83 patient organizations from 52 countries working on the lymphoma space, and a central hub of consistent as well as reliable information, including robust data on the lymphoma patient experience. This series of webinars is a joint effort of EuroBloodNet, Cutaneous Lymphoma Foundation, Lymphoma Coalition, France Lymphoma Espoir, and Eurordis. And it aims is to disseminate very innovative topics related to cutaneous lymphoma among patient organizations, to improve knowledge, to build capacity about the medical services available in Europe, last quality of life, cutting-edge advances in the field. Cutaneous lymphomas may have a profound impact on patients' health-related quality of life and psychological well-being. With this in mind, this fifth webinar will target quality of life, fatigue, itch, and skincare, and psychological impact. Before introducing our speakers, some housekeeping rules. Today's webinar is being recorded and will be available through the EuroBloodNet Edu YouTube channel. Please, we will appreciate if you switch off your cameras and mute your microphones to facilitate the audience focus only on the speaker. The webinar starts with approx 25 minutes of presentation, followed by 35 minutes for questions and answers. You can type your questions in the chat box at any moment during the session, but time will be allocated at the end for speakers to address those questions. For today, we have two speakers, and we have with us also Susan Thornton, the CEO of the Cutaneous Lymphoma Foundation and one of the promoters of this program. You can read our speakers' bios in the EuroBloodNet website, but I will give a short introduction. Our first speaker is Dr. Julia Scarisbrick. On the words of her patients, Dr. Julia is always very warm and caring and interested in the person behind the disease, as well as providing excellent care. She is consultant dermatologist at the University Hospital Birmingham and leads the cutaneous lymphoma service. She's the chairman for the European Organization for Research and Treatment of Cancer, the EuroTC Cutaneous Lymphoma Task Force. And this is really special because that body focuses on develop tools for the assessment of quality of life, among many other things. And we have also Jenni Burrows. She's a textile artist and art teacher based in Cornwall in UK. She used textile art as a therapy while experiences diagnosis and treatment of cutaneous lymphoma. She has a Bachelor of Arts honors from the University of Ulster in Fine Art Craft Design and a Master of Arts in Contemporary Embroidery, and is a qualified teacher with a postgraduate certificate in education in art and design from the University of Brighton. But she has also worked in Africa for voluntary services overseas, training students in interior design, textiles, and garment production. I will let to her and to the both speakers to facilitate the topic today. So for our first speaker, Dr. Julia, the floor is yours.
Thank you. Thank you for the very nice introduction. So today I'm going to be talking about how we can measure and improve quality of life in patients with cutaneous T-cell lymphoma. So for the contents of this lecture, I will start off talking a little bit about why health-related quality of life is so important in cutaneous lymphoma, and why it is affected and reduced in patients with skin lymphomas. Then we'll talk about a little bit how we can measure it, because if we can measure it, then we can look to improve it. So we'll end up by talking about how we can improve quality of life. And just a few questions just to get people thinking during the session. How do you think we can best improve health-related quality of life? Is it with better treatments? Is it with better symptom control, better psychological support, or more patient information being available? And we can come back to some of these items as we go through the talk. So why is quality of life reduced in patients with skin lymphoma? Well, cutaneous T-cell lymphoma is a visual disease, so it obviously is not something that a patient can necessarily hide from during their daily activities. It's often associated with symptoms which can be very disabling, such as severe itching, pain and burning of the skin. Also, unlike other skin diseases like psoriasis and eczema, it is a cancerous disease, and there's that worry of the diagnosis of having a skin cancer. And then there's other more specific features which can be upsetting for patients, such as large tumours on the skin, which are sometimes malodorous, hearing loss, tiredness, and difficulty regulating their temperature. And these things are not always seen in all types of skin disease. So it really sets this group of patients apart and means we need to think carefully about how we can improve these. So quality of life is something we talk about a lot in medicine, because it's obviously very important that with our treatments that we actually improve the patient's well-being as well as improve their disease. But quality of life is not just health related. And you can see here from this list, lots of things affect quality of life, which aren't necessarily related to skin disease, such as education, personal security, work-life balance, mobility, cultural issues, income and jobs, housing conditions, as well as health. So health is just one part. So we sometimes, instead of referring to as quality of life, have the abbreviation health-related quality of life, or QoL. When we're talking about those things which are actually related to the patient's health problems. So in medicine, things often get a little bit confusing. We often have words that we use in medicine that we aren't always using in everyday life. And obviously, if this is something which is to improve our patients' quality of life and well-being, then obviously they need to be able to at least understand a little bit about what we're referring to. So I just wanted to go through some of our definitions and some words which you may hear when we're measuring quality of life. So our European Organisation for Research and Treatment of Cancer was touched upon in the introduction. This is a centre which centres in Brussels, but we have fully international members, mainly just in Europe, but some from far away. And there's a different group for each type of cancer. So I'm chair of for the cutaneous lymphoma group, and then we have links to other groups. So there is actually a quality of life group who we work very closely with. There's a lymphoma group as well as a skin lymphoma group. There's a melanoma group, etc. So these are very specific groups with a lot of expertise within them to try and design better trials and try and improve patients' outcomes. So the definition we use there for health-related quality of life is the subjective perceptions of both the positive and negative aspects of cancer patient symptoms, including physical, emotional, social and cognitive functions, and importantly, disease symptoms and side effects of treatments. And when we talk about things called issues, we're basically talking about symptoms, so the thing that affects the patient, so itching, pain, burning, sadness, they're all issues, and they need to be measured, and the way we measure them is using something called an item, which is a question. So which is the best question to find out how much of an effect itching or pain is causing for that patient. And then we measure them using questionnaires where you have a list of questions or items to try and understand how a patient is feeling about their disease. And these are some of my patients who kindly offered up photographs. Obviously, these patients were all seriously affected by their condition. It can cause severely painful hands. It can obscure your vision in advanced cases. It can have multiple lesions on the skin. It changes your physical appearance, so you no longer have the same identity. It can cause severe itching and painful weepy lesions. So all of these can have a massive impact on a patient's well-being. So when we're looking at the health-related quality of life questionnaires, we divide the issues or the questions up into groups. And the main three groups we call domains. And these questions, some of them will be about symptoms. So things like pain, itching, fatigue, difficulty sleeping, shivering. Then the next group will be on emotions. So are you feeling frightened, sad, angry, lonely, embarrassed or ashamed of your skin? And then function. So are you able to work? Can you use your hands freely? Can you play sport? Can you drive? The trouble is, at the moment, we don't have one quality of life questionnaire which covers all these aspects for patients with skin lymphoma. And that's because we have our very skin-related ones for sort of eczema and psoriasis, like the Skindex 29. And then we have the sort of cancer ones, which deal with cancers, but often cancers which are internal. There is a 12-item MF Cesare CDCL questionnaire from patients like me, which Susan Thornton's developed with her group. And there are some other various scales and questions which can help specifically with different symptoms like itching or pain. But it's very time consuming if you ask a patient to fill out multiple questionnaires, and patients get definitely get questionnaire fatigue, and I think the quality of answers you get and the relevance of them reduces with the number of questionnaires you're filling out. The one that we tend to use, and the one we use for our biggest study for patients with skin lymphoma, called ProClippy, is the Skindex questionnaire, and this was designed for skin disease, so it doesn't have those skin cancer questions. And as you might expect, you've got the 3 domains covered: emotion, symptoms, and functioning, and you have 10 emotional items, 7 symptoms, and 12 functioning items. So they're the questions there. And then you report those on a scale of never, rarely, sometimes, often, and all the time. And a lot of our clinical trials use these questionnaires to see, alongside whether a patient's disease is shrinking and getting better, that their quality of life is improving. And with skin lymphoma, most of our treatments don't result in a cure. So a patient is having an improvement in their skin, but not a cure. Therefore, the improvement in health-related quality of life becomes very, very important, because if you're only slightly reducing their disease on their skin, you want to make sure that actually that reduction is associated with the patient having a better outlook. So here you can see, I'll try and engage you. So up here you've got the scores. So the higher the worse, and the lower the better. And you can see with brentuximab, which was one of our drugs for skin lymphoma, that when you gave it, the patient improved. So their health-related quality of life got better. And that was compared to the physician's choice arm, which is the other arm of the trial. So not only did they find that brentuximab got the skin better, they also found that the patient well-being was also improved. And the Maverick trial, another big trial, this one, a drug called mogamulizumab, which you tend to use for Sézary or blood involvement in skin lymphoma, had a similar effect when you compared it to the other arm, which was vorinostat, which is an oral tablet. Patients had a better outcome and a higher quality of life afterwards. I mentioned a little bit earlier about ProClippy. So this is a study I'm particularly proud of. It's a prognostic index study. So we're looking to try and find out which of the factors that might affect the prognosis or the survival of patients or outcome of patients with skin lymphoma. So we can identify those patients that might need more intensive therapies and other patients that might need less therapies. And in this, we measure quality of life alongside treatment and clinical factors as well. And so we looked at the quality of life, and this paper has been published. We've looked at patients, and this is what we found. So we found that the things that seem to affect patients' quality of life were some things which we just couldn't alter. So, for example, female gender had a worse quality of life than male in this study. Hair loss was one of the most important factors, which isn't necessarily something as a physician you necessarily would think of, but hair loss in patients was associated with a much reduced quality of life and well-being. Sézary syndrome, which is a particularly aggressive diagnosis, and the later stages of mycosis fungoides. A blood test, which is a raised serum LDH, which is usually associated with worsening disease. A high skin involvement and redness all over. So a lot of these things we found were associated with patients that had more advanced disease. And the thing with skin lymphoma is that you sort of sometimes weight your treatments to those, but actually most of our patients, 75% of our patients actually have the early stages. And it may be that in a questionnaire like this, we're missing the important quality of life questions for patients with the earlier stage disease. So you weight it for the patients that have a more advanced disease. So we've looked back at our patients, and now rather than just 290, we have 814 patients with quality of life measures with an age range between 47 and 70. And interestingly and somewhat pleasingly, we have a high a high number of males completing questionnaires. So we do find that, so the ratio of males to females is about the ratio that we see in mycosis fungoides and Sézary. So we expect that about 1.6, 1.7 times as many men have it than women. So actually men and women are equally filling out our questionnaires, which is excellent. In the past, men have been a little bit more reluctant to do this. So we're really delighted that we have an even balance. And what we wanted to look at is all of our centres in Proclippi are specialist skin lymphoma centres. So does patients' quality of life improve once they get to the centre? We know that the diagnosis of mycosis fungoides and Sézary syndrome is often delayed. Up to 3 years, and that can obviously result in lots of anxiety in patients not knowing what's wrong with them, their skin not getting better with the treatments they're being prescribed. And you can see quite clearly that in all of the domains, the symptoms, the emotions and the functioning, all the line drops as they have more visits. So this is visit 1, visit 2, visit 3, visit 4, and visit 5. And maybe it's plateauing off a little bit at visit 5, but certainly the first 4 visits, there seems to be an improvement. And that's mirrored by the overall global, which is just the 3 domains added up. But what's important? So to say, what's important in improving patients' quality of life? Now, we know it's going to be individual, and what's important to one patient won't necessarily be important to the next. But generally, there are trends, and it helps us to understand which are those important questions. Is it itch and pain, worry, sleep? So what we did is we looked at the questions, and then, as I said, patients score them never, rarely, sometimes, often, and all the time. So we looked at the ones that patients were reporting often or all the time as things that maybe we should try and look at improving. And what we found is the 2 that ranked highest was the worry that the skin condition may worsen and that it may be serious. So quite psychological support there probably needed to explain and guide a patient through their patient journey and hopefully allay some of those fears. And then it was more, after that, it was more symptoms like itching, sensitive skin, irritated skin. And then came sort of more sort of emotionally angry or frustrated answers, worrying, and then finally some feelings of tiredness and malaise. So it just gave us an idea of the top 15 out of 29 questions of the things that are most important or maybe most important to our patients. And we're currently trying to, or in the process of developing a skin lymphoma specific quality of life questionnaire with our quality of life EuroRTC group, and Simone Orleans is the chair of that group. And we have centres in Vienna, Switzerland, Germany and Italy. So it's a truly international study. And as I mentioned before, it's important that we don't just cover the most aggressive forms of the disease, which is around about 1 in 4 patients. We need to look at some of the B cells as well as the T cell skin lymphomas and how they may affect a patient, and the early stages of mycosis fungoides. And for a questionnaire to be successful, it needs not to be too time consuming, as I mentioned about the problems with questionnaire fatigue. It needs to be easy to understand, and it needs to be specific and relevant for the disease. It does need to consider age and gender differences. It needs to be validated, and it also needs to be available in multiple languages. So back to the sort of original question, how can we improve patients' quality of life? We've talked about the different ways we can improve symptoms, we can provide emotional support and function. And I think one of the most important things is supportive care to improve health-related quality of life. And that's something which is relatively easy to provide for all patients. And it's treatments alongside their anti-CTCL treatment. So apart from the treatments actually directed at reducing the skin lymphoma, these are for other things that may affect quality of life. So we heard that itching can be a big problem, and there's multiple different treatments that can be directed towards the itch. Sadly, none are 100% effective, but they may help. And skin infections can be a problem. Pain relief can be addressed. Difficulty sleeping, either counselling or short courses of sleeping tablets. Functional support for, dressings for hands, pain relief, physiotherapy to help patients become more mobile. And then very importantly, the psychological support and the realization that these patients do have a cancer diagnosis, and they can, and that can be frightening and needs to be addressed. So I'd like to now hand over to Jenni. I'm very happy to take questions at the end. I hope you found it useful, and I value people's feedback. Thank you.
Thank you, Julia. So my name is Jenni Burrows. I'm a textile artist and an art teacher, and my work dramatically changed when I became diagnosed with cutaneous skin lymphoma in 2015. And my team at Guy's Hospital, led by Professor Whitaker, have been a catalyst for the development of my practice, as I've been able to communicate through my art, and I've led workshops for patient groups at Guy's Hospital and co-wrote a paper for the Autic conference as well, called You'll Be Fine, with Danuta Alaska. And this is very important for me in how they enhance my quality of life through their holistic approach to my treatment. Having Danuta as a psychologist on the team, Kath Morgans as a direct contact as my nurse specialist, and also obviously having the professor overseeing my clinical treatment. And I'm going to talk firstly as well about how having Danuta as a psychologist and the time that she gave me to listen to the allocated slots that I had, and her being an expert in her field and really understanding how skin lymphoma does affect us, and also how it affects you if you have a good prognosis like myself. I had a very good prognosis, though at the time it was very painful with my skin and the tumours appearing and rashes. And also being on methotrexate caused me great fatigue. And also trying to carry on teaching and living my life was also making me very tired, which I feel became an ever-decreasing circle, and very easily we can get run down when we become very tired. I think one of the things that I've learned from having this chronic condition is not to get too tired, to pace ourselves, not to feel bad if we can't do what we were doing before diagnosis. But this all takes time, and as Danuta would often say to me, it's like a ship changing course. It takes us time to adjust. And when you're diagnosed with skin lymphoma, there's a lot of adjusting to do. And instead of thinking that I'm not good enough, Danuta was always encouraged me in what I had achieved and how I was carrying on with my life as well. She gently showed me ways to change things that needed changing, and how I needed to adapt. And also, both Kath on the practical side and Danuta fed through to Professor Whitaker. So when I had my appointments with him, it was very much targeted to the my clinical needs, a very holistic approach. And as I said before, something that's really enhanced my quality of life through the treatment. And I've been off treatment now for 3 years, and I'm still have contact with the hospital, and they're still there for me. So I'm just going to talk about my work here. And first of all, I'm just going to talk about the dummy in front of us, which was a collection of work that actually started before I was actually formally diagnosed.
Jenni,
yeah?
Sorry, were you bringing up your slides?
Are they not on?
No, we're not seeing them. So I think you might just have to share your screen again. Sorry, I didn't mean to interrupt.
Sorry.
No, that's okay. I want everybody to see your beautiful work and how you manage that. So hopefully.
I don't know whether it's, sorry guys. So
it's
that's
okay.
come up. Just.
I think, Julia, you stopped sharing, right? So, yeah.
I can't seem to get it. I have to go back out again. Sorry, end show.
It's okay.
I'm panicking now. Sorry.
No, don't panic. Don't panic. Let's see.
All right. My sharing screen's not coming up, so it might be something just.
Mariangela, by chance, do you have the slides? Jenni's slides?
Yes, so one second, I can provide them. Just 1 second.
Great. Thanks for hanging in there, everybody. There's always something entertaining when we have technology, right? It always happens that way. We did it all ahead of time, and it all worked beautifully. That's sort of the way it goes. You think you've got it all.
Well, are you seeing my screen?
Go.
I'm sorry for interrupting. Okay.
Yes. Is this is the one you wanted? Yeah.
Yeah.
Jenni? Okay.
Do you want it bigger?
There you go.
Yeah, maybe like this. Yeah, because
I have it
in PDF, so it's not a PowerPoint presentation, but I can show it like this.
Yeah. There you go.
And can you see that as a full screen?
I don't think she can do it as full screen because it's not in a PowerPoint, Jenni.
Maybe it's like this.
There you go. Yeah, that's good.
Okay, great.
All right.
Are you happy for me to go? Oh,
Yes.
Yeah.
There
Sure,
you go.
please.
Beautiful.
That's better. Sorry, guys. I don't know what's happened there. So if I get back to just talking about the dummy in front, and this was a piece created from lots of little pieces before I'd met the professor and before I'd also had any formal diagnosis. So I had months of waiting to see, waiting for my results, but also being told that it was sure it was some kind of cancer, but not totally sure. So my way of coping was creating these pieces, and also the pieces show in different variations about where the disease was. So the 3D pieces on my hips and around my neck were where that it was most prevalent at the time. And then I had radiotherapy on those pieces. And I just visualized the cells in a vivid color. So I tried to get away from the itch, and where it was smooth and calm and flat. And the process for me was an effective coping mechanism when thoughts became jumbled and I was just feeling out of control. So at that time, it was a very lonely time in which I didn't have a specialist. Nobody was really sure what was going on. And it was something that I could really focus on and create a piece. And then this was shown at the Aortic exhibition at the conference in London in 2017. And then I had the opportunity to go to America, and I met Susan and her team. And the chair is inspired by my trip to America in 2018. I was invited to speak and deliver a workshop, and the American audience were so kind to me and so gracious, and also very open with their thoughts and how the disease was affecting them. But we talked a lot about wearing clothes and how this can really aggravate our skin. Really every day, the rubbing and the chafing of certain fibers, how that really does affect us. And it's very hard to be working, to be living life to the full with other things that aggravate us. And sometimes these things can be the last straw as well. So we were having a conversation and somebody just said, I want to take my clothes off. And we all had a good laugh about that, because anywhere else it would be totally inappropriate. But we totally understood what they meant. And this piece here is about flinging off those itchy clothes. And it's made of fabrics and threads, and all the 3D pieces that are arisen from the chair are so when somebody sits in it, they have an understanding of what it's like to be sitting with sore skin, with tumours as well, how it hurts, it digs into you. So that was why this piece was inspired. And if I could have the next slide, please. That's great, thank you.
You're welcome.
So the slide of the bra is called Unconventionally Beautiful. And I think another very sensitive issue is when we get skin lymphoma on very intimate parts of our body. And it does highlight a whole new set of feelings and emotions and vulnerability. And I wanted to show that in an item. And this was selected as well for a national event with the NHS in the UK called 70 Stories, 70 Years, to celebrate the 70 years of the NHS. And at the time, I'd had a large tumour on the side of my breast, and it was very painful, and again, wearing clothes. And I just wanted to depict also about how strong and how resilient our bodies are as well to cope with this disease, and how our immune system at times can really respond to it too, and with the treatment. And then the final slide is called Itchy Socks. And I'm very much working with interactive art now. And I want to create pieces that other people can wear to understand what it's like to be living with a chronic condition, and in our case, again, skin lymphoma. And when walking with the socks, it's very painful to walk on the big felt balls that I've made, and also they're incredibly itchy. And many people say they just look itchy just looking at them without wearing them. I've also taken the socks to clinic, and the professor has been very keen to share my artwork with his students. And also because it's a visual and it's an interactive and it's a different way of thinking about somebody else's experience. So these are just 4 examples. And I would like to say that there is hope. There's hope in many ways, because sometimes this can be a very lonely disease. And I was just reminded at the weekend, after listening to the Cutaneous Lymphoma conference and listening to some of the top experts, and also Julia as well. They work really, really hard, and they're always traveling, they're always communicating, and they're always researching. And our treatments are getting better, and they're always changing, and there will always be hope. So if it's a day of fatigue and itch and soreness, there are people out there really looking out for us. Thank you.
Fast enough. Thank you. Wow. Jenni, I am always moved when I hear you present, because I think it really brings home and off the paper, right? The real experience of those of us living with cutaneous lymphoma and the impact of having skin lymphoma. And from what Julia spoke about and took us through all the different quality of life and how do we measure and how do we then bring those pieces together, put it into clinical practice, support all of the patients. I think these pieces are so intertwined. And for me, being able to see both presentations back to back brings home the importance of all of the components, the individual experience, but the data collected across the broad brush of patients so that we can change clinical practice, or we can bring more awareness to the impact of living with this beyond the treatments and the disease itself, because that's all plays a role in all of that.
I've just had a request, actually, somebody wants to buy some socks, so that's great.
So now you're going to go into production of
I've got my mini Etsy.
There you go. There you go. Wow, this is great.
Thank you, Susan.
Yeah, thank you. Thank you. Julia, I don't know if you want to jump in with any thoughts on having watched Jenni's presentation, and you've seen a lot of patients as well. I don't know if you have any thoughts from the clinical side.
Clothing's really important. Certainly what Jenni makes is absolutely beautiful and fantastic. But even some of the other things like the Derma Silk ranges, which are basic but very calming on the skin. We often recommend those as well. But yeah, I think it's very individual thin clothing. So it's nice when there's stuff that can be individually tailored to a patient, but obviously that isn't something that everybody can get access to. So it's great that Jenni's here today. No, I think it's really important. I would really like to hear from some patients what they think and how they can have their voice.
Right. Yeah, exactly. Well, please feel free to either you can unmute yourself and put your camera on. This is an open time that we have with both Jenni and Professor Scarisbrick. So please don't feel shy. We really welcome your questions, or you can type them in the chat. So while we're waiting for some of those questions to come through, Julia, there's a question regarding, oh my goodness, you know, the combination of the different quality of life surveys that, you know, we've kind of combined and pulled together, and, you know, average of three or four per study, it does add a burden, right, to the patients, as you suggested. But also on the flip side, for the researchers to analyze all of that data coming from the different instruments has got to be problematic as well. How do you identify the most relevant findings from all of that? Is you know, is there a way to simplify that? And
well, yeah, we hope that's a very timely question, actually. So we hope we have. So we now have, as I say, we have nearly 900 patients having filled out consecutive quality of life questionnaires. So we're getting lots of information, and of course lots of things affect it. So for example, you know, your first visit, we hope patients will come away from our centre feeling better just because they're in safe hands, and you get that sort of holistic, more comfortable, you've had your diagnosis explained a bit better. We might not have made any difference to symptoms yet or functioning yet, but just that emotional improvement. So we try and look at ways we can globally understand this. And what we've done is we've added what we call an anchor question. So on top of the 29 Skindex, we've just added one simple question, which is a scale from -5 to 0 to +5, is how do you perceive you're feeling now? So that we can try and use that global number, just that general overall, which is, I guess, the most important, how that patient is feeling overall, and see if we can link that to some of the more specific questions and the difference and how it's fluctuating from visit to visit. So we're hoping that actually sometimes simplifying the questions and actually getting an overall feel, if we can then relate that to specific questions, will hopefully help us understand when a patient is, when we are making a patient feel better.
Yeah, because that's really the bottom line, right? And sometimes even if the treatment is slow going, we also know in this disease that it's not an immediate response to the treatment. So if you have very painful, sore, itchy skin, 1 week of treatment isn't necessarily going to wipe that all away in one fell swoop. But to be able to really show over the course of time that, yes, capturing that, right? So maybe taking that psychological burden off can actually give someone the capacity to be able to deal with that time factor in starting a therapy and seeing some response, you know, rather than having to grapple with all of those things.
Absolutely, Susan. I mean, that's right. Because that will give you an idea, actually, is, you know, I might say, oh, your treatment's working really well, but actually if that patient's quality of life isn't improved, then does that matter in a disease where you can't get a cure? It's different if you're treating an aggressive leukemia, which you're expecting to cure. So a patient may have a miserable time during treatment, but treatment is 6 months. All of our patients are treated throughout their life and have most, apart from a very few lucky ones, most patients have some skin disease all the time. So unless they feel better most of the time, then we're defeating the whole point of therapy.
Yeah, and that's such a challenge. Let me see, we've got some more questions here. Let's see. To Jenni, if you have a chance to incorporate advice to improve clinical practice for cutaneous lymphoma patients based on your personal experience, how would you like to bring that to the next level of care, and what did you miss the most? What do you think was missing?
I was incredibly fortunate being a patient at Guy's Hospital. Can you hear me?
Yes,
yeah?
Go ahead.
Yeah, good to hear me out. That's good. And actually, I don't think I missed out on anything, and I can honestly say that because Professor Whitaker was one of the leading experts, but he had such a great team as well, and they all worked very well together. And I felt I was the only patient when I would go in, and my program was very tailored. I had a connection that I could ring my nurse when I needed to. Also, there was another very important factor actually that I didn't mention, but when I was in clinic and it was decided I needed radiotherapy, I would meet my clinical oncologist and also some of the team before I went for treatment. And that made a huge difference because I wasn't meeting a whole new set of people, having to explain it again. They already knew me. So I really did have, and I still do have, incredible care. And I really can't say that there's anything that I missed out on.
Yeah. Yeah. And I think that's one of the challenges in this disease, as well, is that not everyone has access to an expert center, or a lot of the centers, they may have those services available, but they're not encapsulated within the cutaneous lymphoma clinic themselves as participants. So I think we have some work to do to almost create the gold standard of clinical practice, and then share that out with the clinical community, and help bridge that gap, right, to what patients may need, and they may not even vocalize that. I think that.
Yeah, I really do believe that having the psychological care, at the time, I didn't think I needed it. And then it became as important as all the other treatments, because I then began to work through how to live with this disease. Because when I tell people I have, or I have to tell people I have cutaneous lymphoma, many people say, oh, the prognosis is fine. But I say it's living with it. The challenge is living with it. And we want to live great lives. We want to live healthy, fun lives. And so that is something that I really had support with, and I still do. And I call it a Danuta pit stop, because she still touches down every sort of 3-6 months, just to see how I'm doing. And I wish so many more patients could have it too, because it really is invaluable what I have.
Thank you. And I think Brigitte has a question. I think if you want to unmute, there you go.
Hi, my name is Brigitte Huibrechtse, and I live in the Netherlands, and we have an expert center in Leiden. Yeah. And they're doing a great job on research, but everything else that's being talked about here is not happening. Really, really sad. So we've been talking with them for almost 2 years now. They feel very constrained financially by the hospital. So we're working on it, but that's a bit of a problem. So we would, of course, love to come and visit you and to really understand what's happening at your hospital in the first place. And then in the second place, my question is really, well, where do we start? And if they would get money, well, what is the way to start helping patients to really live with this disease?
Yeah. So, I mean, I actually worked alongside Sean Whitaker in London, and then moved to Birmingham because there was nowhere in the Midlands that was doing skin lymphoma. So poor patients were being looked after in small centres. So I modelled my centre in Birmingham on the London centre. So it's very similar. And where did I start? I started by getting some really good CNS nurses, because they are absolutely crucial to the smooth running of the service. They provide telephone support, email support. Alongside my secretary, they sort of balance when a patient's coming, how they can be fitted into clinic when they need to be seen. And then growing on that, I then got another dermatologist in, so there was cover when I wasn't there, a hematologist in. We have 2 clinical oncologists offering radiotherapy in different areas of the region. So I sort of built amongst it, but I would have said where you start is some really good dedicated CNS nurses that understand the disease, understand the individual problems. And because skin lymphoma is so diverse, from the patient that has a few patches, but those patches may really impact that patient's well-being, to someone who's got a very terminal diagnosis. So you have to be able to juggle both and make both patients, improve both patients' well-being, and make the person who has the early stage disease feel that they're as worthy, because for them, this is their disease and their cancer, and it's irrelevant if there's patients who have worse disease. So it's understanding, you know, understanding how all patients can be helped in a holistic manner. But I'd say my CNS nurses, without doubt, I couldn't run the service without them.
Okay, thank you very much.
Yeah, and I think that's a great point that you bring up, Brigitte, is that, you know, all the health systems around in the world are constrained in various ways, whether it's you know, the services, the resources. I think with COVID have certainly been impacted hugely, right, by how staff is functioning. And I think there's, at least in my opinion, you know, our community of cutaneous lymphomas is very well connected around the globe. The clinicians, the researchers that specialize in it. And now we're building this network of patient organizations. So us with all of you in the Netherlands. And I think bringing those things together, creating this powerful network where people can come to us. We know how to support them, send them to the right centers. And if there is no center, because in some countries or in some geographies, there are no specialists, then, you know, that's one of the things that EuroBloodNet is trying to do, is to create that clinical network for physicians to be able to access the experts as well. So we've got a lot of work to do, there's no doubt, but I'm really excited about where we are today and this landscape of pulling everybody together. I personally think that's one of the blue or the silver linings of COVID, and having everybody around the globe using technology like this. It's sort of made it normal for people to connect, no matter where you are, what your language is, what your culture, what your time zone. So I think taking that forward and being able to share can really move the needle a little bit faster. And if there isn't something at a center, you know, the specialty center in one country, well then, being able to bring data to the table, which is what Julia was talking about. And for us through the Lymphoma Coalition, our global patient survey. So it's from the patient perspective, the impact of the disease. So pulling the data together that we can then present to health centers, to regulators, to policymakers to say, you know, this is really important. And then, you know, you can add the economic piece to it too. And this is how it impacts these individuals living with this disease in this country to be the best citizens in the country, to be able to work, to be able to live their lives. So I think all these pieces are coming together that will make a difference. And I think the more we have conversations and can connect about it and share, I think the better, the faster we'll be able to move forward. At least that's my dream and vision. It'll take us some time to get there, but thank you for bringing that up, because I think that's a really important point. Yeah. Let's see. Aha, and we have another question here. If either of you would like to answer this, but what, in your opinion, do patient organizations, you know, we just talked a little bit about that, but what role can patient organizations, or do we play, or should we play to help shape better care? And you know, for you, Julia, do you refer people to the patient organizations? And, you know, Jenni, what has your experience been in engaging from that and gathering support and so forth, kind of beyond the walls of the institution and the actual sessions, right? Yeah.
I think for some patients, the patient organizations are absolutely perfect. Some patients like to communicate with other patients with the disease, and it's great for disseminating information and making people feel less lonely about their disease. I think that, again, you know, that going back to the diversity of disease is that we have done some patient groups, but sometimes it's very difficult when you've got a wide range of patients with different stages of disease together talking, because sometimes what is important to one group isn't necessarily important to the others. So I think big organizations like yours are great because they've got lots of people and you can tap in and find someone who's of a similar mindset. You find it's good to talk to, you find the right bit of information. But you know, smaller patient groups, I think, struggle with the rare diseases. So the bigger ones, we have the Lymphoma Association in the UK, and we have a subgroup of that, which is very helpful. But certainly the Cutaneous Lymphoma Foundation really is the golden globe, isn't it? For patients with skin lymphoma who want that sort of support. Right. It's not for everybody, but for the patients that want as much information and communication, then it's a perfect conduit for that.
Thank you, Julia.